We're glad to have you join us on the program today. Here we keep you up to speed with activities from the 57 local council areas of the state. I am Taiwo Babatunde on Ibile Update today. Residents of Mushin local government have been encouraged to enroll in the Ilera health insurance scheme as the council intensifies grassroots sensitization to expand access to affordable health care. The initiative is aimed at promoting universal health coverage while protecting residents from financial burdens to medical expenses. Shiwa Bimbola reports.
Ilera, I'm sure we've heard of it. So it is now mandatory. Everyone in Lagos State must be on Ilera. That is the reason why we are here today.
According to these health awareness officers, the Lagos State's Health Insurance Initiative seeks universal health coverage for all residents, targeting higher life expectancy and financial protection against devastating healthcare costs.
This engagement is not merely another gathering. It is a strategic platform for collaboration, dialogue, and collective action. Recognizing that not all residents can afford the premium, the state government has made deliberate provisions for vulnerable and indigent populations through the allocation of 1% of the Consolidated Revenue Fund as equity fund. Notably, this fund has been increased from 1 billion to 3 billion naira.
The Lagos State government, through the Lagos State Health Management Agency, has launched an intensive sensitization campaign to enforce the Ilera health insurance scheme. And this gathering in the Mushin Local Government Council office creates an opportunity for an interaction that the council authority believes will yield positive impact for residents of the area.
As your health matters to this administration of Mushin Local Government, ably led by Honorable Onatomoso Arui, we are committed to taking this message to every street, market, church, and mosque. We will work with LASHMA, our PHCs, CDA, and CDCs, and community leaders to ensure that registration is easy and accessible to all.
Service yẹn ó wà very important fún àwọn èèyàn wa. Ṣé mo pé ẹni tí ara ẹ̀ lé koko tó ṣe dáadáa lè lọ bá lọ́la pé ẹgbẹ́ wa o àsìkò èkó tí ń bọ̀ o ẹ jáde kẹ́ wá dìbò fún wa.
The chairman of the area implored CTC chairmen to become ambassadors of the initiative in their localities, describing the initiative as a financial lifeline that blends social protection with economic empowerment.
Because a lot of us a kì í sábà ka ọ̀rọ̀ ẹ̀ tí wà kún. That's the problem we have. Ọ̀pọ̀lọpọ̀ àwọn ẹ̀yìn wake up mo ti jí kò sí tó ṣe mí ara mi ti wà okay. So a kì í wo ẹ̀ tí wà dáadáa Ọlọ́run kò jọ ẹ má jẹ́ kí a gbé èrò ayé sí ọkàn ju àǹfààní ara wa lọ.
It is to save our Lagos State residents the financial hardship from medical care, for quality and access care for all Lagos residents, and to save them from financial catastrophe as a result of accessing medical health care. So the saying says prevention is better than cure. So if you come into the health insurance pool, you have quality to health care services, which will give you good benefit for your healthy living.
These community programs typically focus on grassroots health awareness, hygiene, environmental sanitation, and registering residents for the Lagos State Health Insurance Scheme. Ilera Eco is a mandatory social health insurance scheme designed for all residents of Lagos State, providing access to quality and affordable healthcare services.
My name is Comrade Akim Olalekan Dauda, the Executive Chairman, Ikeja Local Government. Watch Ibile updates on LTV.
Residents of Agege local government, particularly expectant mothers, nursing mothers, and children, are set to benefit from improved access to quality health care following the flag-off of the 2026 Maternal New Child-Born Adolescent Health Plus Nutrition Week. The initiative is designed to reduce maternal and child mortality by providing free healthcare services and promoting healthier families across the community.
Prioritizing grassroots healthcare delivery takes center stage in Lagos State as local councils step up efforts to curb maternal and child mortality. In Agege local government, the 2026 Maternal, Newborn, Child and Adolescent Health Week was officially flagged off, offering free comprehensive health services across the community.
For us is to target people who are, vulnerable within our community, and those are people who really need all of these programs. We need the sensitization, we need the information. So we are doing that and we are not giving up. We'll continue to do more and more of that. And for us as well, the people who can afford it, don't let it be when it's an emergency. That's when you can now come and get healthcare services.
The initiative provides a broad spectrum of completely free services, including antenatal and postnatal care, family planning for men and women, deworming, growth monitoring, malnutrition screenings, and vitamin A supplementation aimed at safeguarding early childhood development.
As we officially flag off this year's MSH Week, let us renew our commitment to reducing maternal and child mortality, improving nutrition, increasing immunization coverage, and ensuring that no mother, child, or adolescent is left behind. Together, we can build healthier families, healthier communities, and a healthier future.
Dr. Shola Piton, Permanent Secretary, Health District 1, emphasized the state government's resolve to make primary healthcare accessible, equitable, and efficient at the grassroots level.
As we keep educating our people, as we keep giving them the right information, and making healthcare affordable and easily accessible for them, what you will see is that our healthcare indices will keep improving. Maternal mortality will drop, neonatal mortality will keep dropping, infant mortality will keep dropping. You'll see immunization coverage expanding. You'll see nutritional status of our children increasing, and so on and so forth. Overall, the impact is that our society will benefit more.
Under the leadership, the chairman is urging all residents, particularly expectant mothers and guardians, to take full advantage of the intervention while highlighting the various health policies of his administration.
For us, we are building health booths, across 10 locations within our local government, and we are going to be increasing that to about 18, within the local government as well. We have 36 zones, 18 health booths will have a massive impact, within our local government, and we are further, equipping about 4 primary health centers, within Agege local government. We are starting the building of 2 primary health centers, one at Papa Oko Olusoya, and another as Ilera Ward A of our local government. So there's a whole lot, we are doing.
The Health Week will see residents access free specified health care across all primary healthcare centers and designated posts.
And finally, the chairman of Ikosi-Ejinrin Local Council Development Area, Adewale Raji Anomo, has called on traditional rulers, security agencies, local security outfits and residents to remain vigilant and security conscious in order to prevent security breaches within the council area amid the challenges facing the country. More in these reports.
Stakeholders from Ikosi-Ejinrin Local Council Development Area gathered at the Council Secretariat to deliberate on proactive measures to be put in place to forestall security breach in the area, especially the interior and border villages. The chairman, Wale Raji Anomo, spoke about measures being put in place to aid security agencies and others in the task of securing the local council area.
The most fundamental right and practice of any government is the security of life and properties of its people. And we also had the opportunity, to tell them what we have done so far on the issue of security of life and property. So we also invited our service chiefs from the Army, the Navy, the police, the NSCDC, and even our local security architecture.
Royal fathers, security agents, and others gave advice on measures to be taken to make the task easy for all.
We don't want people to spread fake news. You have to see it directly before you transmit or you start disseminating a false information. Because a lot of things that is happening now, there's a lot of AI and people used to believe in it. So we just do some AI. They will mention one community, we are coming there. We want you to discuss something. But when you see something, please say something.
Information is really is key. It's key to coping security measures. So if you see anything, you must please say something.
The Okada people, they should wear vests and different colors to show this one is from maybe one from Ota, then different villages, so that we know where they are coming from. They will write their numbers at the back.
For some time now, I've dedicated my time to engage the transport union, the Okada riders, the Ritran, the Marwa people. They are the first line of security in this community because they factually know people that come in and go out of this community.
Traditional chiefs and residents spoke about the peculiar nature of their communities and their security challenges.
They said they want to constitute this security, this thing. They only mentioned the kings. They didn't mention the bales that are the head of the local community. I believe we should have input too, because we are the one that are holding the helms of the villages and farm the forest and every other things.
We in the Igbo, in Ikosi-Ejinrin, we are peaceful people. This time they mention, I also mention Fulani. In my side, I said, God, do not allow them to mention Igbo people in a bad way. Because we are in Ikosi-Ejinrin. We connect ourselves very well. Every monthly we have meetings in the whole North and Krena. All the suburb of this community, we have meetings and I always warn them that if you're Igbo man, you come to this community, you must know what I'm doing. Just don't come here and do nonsense. And if you do nonsense, I will not take it with you.
Ita za ta kawo haɗin kai wani mugu ba zai samu hanyar da zai shiga ba. It's na this way we are bringing the solution that to solve any insecurity matter. That is the way that we are bringing now. We are not support any bad people at our own people. Even we see what is no good, we will sure say these people is no good. We will try to push it among us.
The chairman presented motorcycles to security agents to ease the navigation of unmotorable terrains, and he also donated communication gadgets with a promise to look into other needs that will make the job of security agents easier in the quest for a safe community.
Before we end the program today, if you have any information to share with us, please send us an SMS or WhatsApp message to the number on your screen. To watch Ibile Update Mondays to Fridays, please tune in at 8:20 a.m. or 12:15 and repeat broadcast at 11 p.m. You can also watch Ibile Update on YouTube. I am Taiwo Papatunde. Thank you for watching.
Oh, yeah.